I'm Dr. Charles Gardner, Medical Officer of Health with the Simcoe Muskoka District Health Unit, here to provide the COVID-19 update for Simcoe Muskoka. When I last spoke on Friday, we had 441 cases. We're now up to 457 cases. As of yesterday, we've had 4 additional cases. None of these have been in our long-term care facility outbreaks. There have been no increases in the cases associated with those outbreaks. So they've been individuals out in the community. If we look at the 4 that have occurred since yesterday, they're people in the age range of 30s to 60s. All of them are home isolating. None of them are in hospital. One of them is acquired in the community, and the others are under investigation, and they all live in Simcoe County communities. We've had 10 newly recovered individuals, making up a total of 350 people that have recovered to date. This is 77% of the total number of cases that we've had, and that is an increasing percentage over time as well. So presently we have 7 who are hospitalized, and we've had no new deaths since I last reported, so that's a total of 36 deaths. We do have information on our Health Facts website, Health Stats website, about severity of cases, the proportion that are hospitalized, and by age, and also an indication how age or other risk factors interact with severity of cases can basically put people at greater risk. Those that are at a higher age are also at a higher risk of being hospitalized or dying, and those who have pre-existing medical conditions as well are at a greater risk. We also have evidence looking at how many cases that we've prevented to date by managing to flatten the curve together. So basically, I've reported on this before. It's based on how steep the elevation was happening, how rapid the doubling time is happening in March and early April, and how we've flattened the curve since then. And the difference between those two trajectories gives you the cases that we prevented, and because of the rapid growth that was happening at the beginning, that number is going to increase exponentially week by week. So right now we calculate that we've averted 24,700 cases. I would also note that we continue to deviate from the province right now with regards to its trajectory. So the province has had a bit of an increase recently, and over the last 2 weeks we've actually had a decline. We had a bit of an incline before that for a couple of weeks, and now it's been going down and continuing to go down. So that plays out in terms of our incidence rate. So for Simcoe Muskoka, we've had a reduction down to 6.1 new cases per 100,000 population last week, and the week before that it was 7.9. So it's good to see that decline when it's just good to see it, period. I certainly feel for elsewhere in the province where they've had an incline or an increase over the past couple of weeks. That's also showed up with regards to the doubling time, so the amount of time it takes before you would end up with twice as many cases at the present rate of growth. And we want to see that number get ever bigger over time or increase over time. And so we've seen that here in Simcoe Muskoka. Last week it had increased to 86.5 days, so it would take 86.5 days to double the cases that we would have if we were growing at the rate we were last week, as opposed to the week before, which was 32.7. So that's certainly a positive indicator for ourselves that we're starting to see some decline over the past couple of weeks coming off of the plateau. All of this is because of our hard work together with physical distancing and with case and contact management and follow-up and testing. So we do know from our modeling that our modeling data that we have up on our website, that if we were to relax those things, if we were to let go that physical distancing that everybody is doing, with a 2-meter setback from other people when you go out, and the need to wash your hands frequently, and to self-isolate if you develop symptoms and seek testing, and to now we're recommending wear a mask if you are in a location where you cannot physically distance, such as in small shopping locations or on public transit. If we let those things go, we can see this get out of hand again and grow on us again instead of continuing to come down. And we also need to continue with our testing, which certainly the province is very much pushing at this time. Because by testing those who have symptoms, you identify that whether or not you're a case, and then we can follow up and assist with having cases be in self-isolation at home, and follow up with their contacts and have them go into self-isolation and help break the chain of transmission. So we've done a good job. We need to keep doing a good job if we're going to continue to bring this down and get back to more normal living. Noting this is going to continue for the duration of the pandemic. There'll always be this concern about transmission coming back if we're not careful, until we can achieve herd immunity through vaccination sometime late next year is what we're thinking will happen. If I look at our outbreaks, we have 3 homes that are still in outbreak. Owen Hill Care Community, Bayview Retirement Home, and Collingwood Nursing Home. There have been no new cases, and so we're closing in on the period of time when we'll be declaring them to be over. We still need to be very careful with them to bring them truly to an end, so it's not over until it is actually over. But certainly we're headed in the right direction with them. We've done testing in these facilities and had results come back that are otherwise negative, apart from the cases that we've identified. And I've given out the numbers before with regards to the total number of cases in these facilities. They are unchanged since I last spoke on Friday. If we go to our website, to our Health Stats website, it's had a new look for the past week, so I certainly invite people to have a look at that. It has a lot more information, particularly about the nature of severe cases, the profile of the people that have been more severely affected, and also how the transmission pattern has changed over time from March, April, and May. It's shifted from being travel-related to being community-acquired, and also the long-term care facilities. So certainly I would advise people to have a look at that, and also includes, as always, our epidemiological curve. And as I said, I'm more hopeful now that we are starting to come down in our numbers. We need to keep up all our control measures to continue to bring it down. I do know that with the good weather, people have been wanting to get out and enjoy themselves, and I've always said it's important that people actually be able to get out and get physical activity. I'd always noted that those are above 70. The chief MOH had advised that they not go out. But I think on the whole, it's important that people be able to get out and be physically active for their mental well-being, their physical well-being. But you need to do it in a very safe way, exercising the physical distancing, the 2-meter setback from other people, the hand washing, not going out if you're unwell, and seeking assessment. And also being very careful about going out to shop, because you can get into more confined locations where you might get exposed to people. So choosing to do that less frequently, getting it done once a week if you can, one individual from the household doing it. So now that the weather is better, we are getting more people going out. I think on the whole that's a good thing. It's just that we need to continue to do that safely. I have seen personally some people congregating now in larger groups out in the community. It's actually a violation of the directive from the province where it's a limit of no more than 5 people together like that. And I would say that even more of a concern is I've seen these people not physically distancing when they're doing it. If in fact they are forming a network of people like that, then that becomes a means of transmission in the community. And if we're not careful, we might very well see the elevation of cases that we've seen elsewhere in the province. We need to continue to be careful, even if we're out enjoying the good weather. We need to do it while also physically distancing. So at this point, I'm going to have a look at the key questions that have come up. We've seen since the weekend communication from the province about testing, and now about testing without symptoms, asymptomatic testing. So at this point in time, the recommendations are as such that anyone with symptoms, even if they only have one symptom, can seek testing, should seek testing at an assessment center. We have our 7 assessment centers in Simcoe, Muskoka, and if you want to know their location or their hours of operation, please come to our website and you'll find that listed there. Beyond that, now there's a recommendation for those who don't have symptoms, asymptomatic individuals who've had an exposure to someone who's had COVID-19 or might have COVID-19. And also individuals who, in their work as essential workers or healthcare workers, perhaps people in grocery stores or food processing, if you're in those work environments and you feel at risk, that you can go to an assessment center. They've been, according to the province, been told to test people in those situations, to not turn such people away. We've actually had a dramatic increase in the amount of testing in Simcoe, Muskoka that's happened that timed with that. So yesterday, the amount of testing in Simcoe, Muskoka at our assessment centers was 430, whereas typically it's more like 120 to 130. So that is a 3 to 4-fold increase in the number of tests that's been happening here in Simcoe, Muskoka in response to that announcement. So we've had a question here: how do we address isolation fatigue by balancing risks, the need for more freedoms to improve mental health and getting outdoors? So I have identified that it's important for people to be able to safely go outdoors and then get some physical activity, so fresh air, some green space exposure, but that you need to continue doing it with physical activity, with physical distancing. So there was an incident in Toronto that everybody has heard about at one of their parks, in which there was a very large, seemingly spontaneous congregation of people getting together and not physically distancing in large numbers, and that drew criticism from a number of commentators and leaders. And I would say that I can certainly understand why we would be upset about that. It is indeed a dangerous thing. It's the kind of thing we don't want happening. I think it may be helpful for us to look at what do we need to do so that people have outlets. So these people are seeking an outlet of enjoyment in green space, public space. And there have been changes that have been made in many of the cities of the world, including Toronto, to create more public spaces where people can be out, enjoy themselves, be active, but do so with physical distancing, whether it's closing down certain streets to create walking boulevards or creating more bicycle lanes. So Toronto is very busy doing that. The city of Barrie has done that with its waterfront. And I commend that kind of thing, and I would think that we need to look at more of that if we're finding that there are incidents where people are congregating too closely like that. I'm aware that some cities have actually drawn 2-meter radius circles in public spaces and parks to help identify the distances that people need to be giving each other as they enjoy those spaces. I think we need to do that kind of thing, and do that kind of thing with, or something similar to it with regards to beaches later on when they become more popular. Then we need to look at how do we help people with those kinds of reminders, perhaps other ways of limiting the number of people that are going into such spaces, just like is happening or should be happening with retail outlets. It's a learning curve for us all, learning how to live with COVID together, considering it's going to be with us for quite a while. So some questions that have come up. The Premier has said mass testing is the province's best defense against the virus, and a new testing strategy targeting specific sectors will be unveiled this week. You spoke previously about your doubts about mass testing of asymptomatic people. What are you expecting in the new testing strategy? Has the advisory group you're part of contributed recommendations for the new testing strategy? Well, first off, I would say the public health measures table that I'm on has looked at many things, but it's actually not been the advisory group for the testing strategy, so I've not been directly involved in that. I am now involved with a group looking at how to implement a testing strategy for Central Ontario, but that group has yet to meet, so I wouldn't be able to comment to that particular aspect of the question. I would say that I have called for a comprehensive, forward-looking, written testing strategy from the province to guide us all in how to approach testing, and that it needs to be multifaceted. It needs to look at testing for symptomatic people, and that's where we've had most of our focus to date. It needs to look at testing of asymptomatic people and indicate when that's indicated. So right now we have some indication that it's indicated, recommended for people that have had an exposure of concern, whether it be with their work or otherwise. I would want to know whether or not there's an expectation of testing in certain healthcare settings. Certainly if there's been an outbreak, then we know that there's to be testing in those settings, or to test all individuals with symptoms or without. And as a health unit, we've certainly abided by that. We've had the province require us to test everybody in long-term care facilities over a 2-week period, which we complied with. All health units complied actually very well with that. We know from the province's data that the return rate of positive findings for tests done for all residents and all staff in long-term care facilities where they are not an outbreak has yielded 2 positive tests out of 1,000. So that's actually a very low return, and it's not clear whether those were false positives. So I think going forward with a broader testing strategy that's looking to test asymptomatic people in particular venues that we'll hear about from the province, whether it's the work environment, whether it is other congregate settings or group homes, whether it is sentinel surveillance of random individuals in the community. We would need to know what the parameters are, and we would need, I think, to know that we're learning from that data, that data is being analyzed and we're getting results back as to the findings, and learning the value of the data, to what degree is it helping us and what is it actually teaching us. So to me, it'd be critical that you have that as part of a test strategy. And I've always said that it'd be helpful to have a seroprevalence study as well, so we can test for the presence of the virus in the airway, which is what we do with the swabs at the assessment centers, and that's looking for the virus right now in a person. And that's one thing, but you can also test for people to see if they've been infected in the past, and that's done with serology, which is a blood test. And to me, it would be very helpful to have a seroprevalence study done in which you have a random sample of the total population get that test, so that we can determine what percent of the population has already been infected and are probably protected, and therefore how vulnerable is our population to future infection. So the federal government is committed to doing that. The provincial government is committed to be part of that. I look forward to that taking place. I think that will be helpful to us, and that to me is also part of a comprehensive testing strategy. I think we need to think about what are the recommendations to come about testing related to schools if and when they open in the fall, and the summer camps, day camps. What are the indications for that? Is it symptomatic children only, or those that have been in contact with? All of these things would be helpful to us to help guide us to carry out the strategy well, and to get meaningful findings that help us control transmission of COVID-19 in the community. Okay. So what are Simcoe Muskoka's testing stats? Confirmed cases seem to be dropping locally, but I'm wondering whether that's linked to the number of tests administered. Any idea how many tests have been given in each of the last few weeks? So we just got this question, and I think we're going to look at that in more detail. What I can say is that we've had the big jump in tests yesterday compared with the past. So in the past, we've had tests in the range of 120 to 130 tests a day, and now we're over 400 in a single day, 430 tests done in a day. So that's your immediate situation. I would say that at our assessment centers, since they started operating, we've had a total of 7,637 tests done. So I think that gives you a sense about things that we've had a big jump over the last day. It gives you a sense as to how many we're doing day by day, otherwise how many have been done in total. I would also say that I've reported in the past about our testing rates and how Simcoe Muskoka as a whole has had lower testing rates, a little bit lower testing than the average for the province, and that testing in Simcoe has been quite a bit higher than Muskoka. So I'd be able to get back with you with those specific figures. Okay, the Provincial Minister of Health is attributing the recent increase in cases in the province to Mother's Day travel, visiting, and gathering. Has Simcoe Muskoka noticed any impact in case incidents that you would attribute to Mother's Day? And I say no, we have not. We've actually seen, while the province has had this increase over the last couple of weeks, we've actually had a little bit of a decrease over the past couple of weeks. So we did not see that same effect. I don't think we should be complacent about that. I think we need to continue to be careful. And the success we've had is because we've been careful. We need to continue to be careful about physical distancing. And also seeking out testing for those who develop symptoms. And now you've got recommendations about seeking testing for those that have had contacts of concern. So stats show the majority of people who get this virus recover. Would this not be the best way to get herd immunity and get this virus over and done with while protecting the vulnerable? So that idea has been tabled before. It was tabled in the United Kingdom, for example. And the outcome there was that they were not able to sustain that idea. People refused to send their children to school under those conditions, and so they made a shift to more of the broader control approach that we've employed. But they did it late, and so they ended up with a very high mortality rate. The bottom line, I would say, for this virus is that about 20% of the people that get this virus end up needing hospitalization, and we're having a case fatality rate of between 7 and 8%. Here, in other countries, it's been as high as 14%, like the United Kingdom. That's a very high case fatality rate. It's more likely to occur in older people and people with pre-existing medical conditions, but it can happen with younger people. And certainly we've seen young people ending up hospitalized in the intensive care unit on ventilation for extended periods of time. It's a serious virus, and it would be highly undesirable to simply let this pass through the community. And furthermore, I don't think anybody has come up with a way of allowing it to pass through the community while protecting the vulnerable. We saw a huge impact on those in long-term care facilities who are very vulnerable despite all of our best efforts to control this. and the likelihood of them getting this happening in long-term care went up with an elevation in the background rate of transmission in the community. So it's a package deal. You've got to protect the whole community if you're going to protect the vulnerable. And if the worst case scenarios is that it gets out of hand and overwhelms the healthcare system, which is of course truly devastating as well, the kind of thing that happened in Italy. And there you then get an even higher death rate because cases that would have survived with intensive care weren't able to get that kind of care because they were overwhelmed. I don't think we can afford that kind of strategy where you just let it go through the population and try to protect others, and you won't be able to protect the vulnerable, and it will have a huge impact on us, an overwhelming impact. It's really not an option. So the World Health Organization has said money doesn't spread the virus, and the Bank of Canada has asked retailers to keep accepting cash, but most retailers are using the cashless tap-only options. Should we avoid using cash? Well, I would say that people need to be careful about shopping in general, and that you need to choose carefully, when you shop, going in frequently, getting it done in fewer trips, having one household and member do this. You can check on our website how to shop carefully. Using a mask is now recommended for close confinement. And when I say mask, I mean a mask that is homemade, not a healthcare mask, because we're trying to retain those for healthcare workers because there's a short supply. And so hand washing is a critical piece of this. Hand washing, before, after, if you have some with you, during when you're concerned because you're touching surfaces that others have touched. Money that you touch is something that somebody else has touched, so that would be an issue in general along with everything else you touch. Your credit card, as you touch the tap, becomes something that somebody else has now touched, and so it too can potentially transmit. You need to be hand washing related to that as well, so I would suggest that this takes you right back to the realm of hand washing as being an important thing to do, and being aware that touching surfaces, including money, including your own credit card or your own debit card, could be a means of transmission. What's a greater means of transmission is simply being close to people within 2 meters, because it can be transmitted via droplets as they breathe and speak, and people can be asymptomatic, and so you can't tell by a person's appearance whether or not they're a case, so you need that to be aware of the distance. Okay. So some stores aren't controlling the number of people in any one time. Why not? Who monitors businesses? The province has put out recommendations for how businesses should operate. And I would suggest that if people see any businesses that they have concerns about, they can call us, and we would look at the situation and see if there's something that the police could follow up on. At this point in time, I'm not aware, though, of any process in place to proactively being assessing or following up with businesses. We are generally advising them that they need to put in place these precautions. I do believe these precautions are very important, limiting the number of people in a business. To avoid crowding is critical. Having reminders about spacing is important. Having one-way aisles is important. Ideally, having exits separate from entrance is important. All of those things help us. Us now wearing face masks is important. Us doing the hand washing is important. Those are important things. And there is guidance out there for businesses. We are promoting that they be abided by, but I'm not actually aware of any process in place to proactively inspect and require that they're abiding by them. So if people are concerned, they can certainly let us know, and we would see what we can do, or have others such as the police do to look into this. Is it correct that under current recommendations family social gatherings with close family members, parents and grandparents, are allowed for up to several days, as long as the total number of people in the house is at 5 or less people. Okay, so there are two things that are still on the go. One is a provincial directive limiting public gatherings to no more than 5 individuals. So that's enforceable. The other is a recommendation from the Premier, from the Chief Public Health Medical Officer of Health, that people only have intimate contact with household members, and that you otherwise exercise physical distancing of 2 meters with all other individuals. So that's a recommendation. It's not enforceable, but it's a strong recommendation, and it's still in place. So those are kind of two different things. If you're out with a gathering of other people outside of your household, A, it's got to be less than 5 people, and B, you still need to be doing the physical distancing if they aren't household members. In my mind, I look forward to a point that I hope will come. I don't know when it will come, because we've had this recent surge of cases provincially. But I hope it comes in a reasonably close future, that we can extend this inclusiveness of intimate contact to a larger group of people in our lives. So that the idea of the social bubble. Right now, your social bubble is just your household. In the future, perhaps you can extend it out to 2 households, or maybe 10 people. And that it's entirely mutually exclusive, and nobody else can be part of that, and nobody in that bubble stands out and has intimate contact outside of the bubble. We shall see if and when that comes. But no, it wouldn't be a good idea to have other people coming and visiting your home who aren't part of your household and having intimate contact with those people. That it becomes a point of danger for potential transmission. And there's a speculation that perhaps the increase that we've seen in other parts of the province lately has been due to that kind of thing happening, related to Mother's Day, for example. Malls and town facilities are closed. Where should seniors and those susceptible to serious health issues go during heat advisory days? Okay, so we have 2 levels of advice as a health unit when it comes to heat advisory days, and one is for individuals about what they can do when there's a heat advisory, heat alert day, and that would be that people find ways of getting out of the heat, essentially. So if you have air conditioning, you can be using your air conditioning. That people, if they're outdoors, need to be mindful of the heat. They can choose times of the day when it's not as hot. They can stay out of the sun, which is also good for sun safety. They can and need to drink fluids frequently so that they don't become dehydrated, that they need to be aware of their level of exertion. There are certain groups that are more vulnerable to all of that. Seniors, people with pre-existing medical conditions, and young children can be more vulnerable to all of that. So that's at the individual level of advice that we give. We also advise municipalities about the approach to setting up cooling centers, because not everybody can go into air conditioning. Not everybody has air conditioning. And people of lower income may be more vulnerable because of that. Large urban centers with a lot of bare concrete can be hotter areas, the heat island effect, and so high-rise apartments can be more of an issue with the inability to get out of the heat. And so it's important that municipalities have designated locations where people in those circumstances can go to get out of the heat, at least for part of the day. It's important with extended heat alerts that people have some time each day out of the heat to reduce the impact on their health, or reduce the likelihood they'd have to seek medical attention, or reducing even the potential for mortality. So it's important that municipalities have places like that they've identified where people can go, whether it's public buildings, whether it's malls that are air conditioned, some appropriate locations where people could go. And for that matter, individuals could take advantage of that if they're aware of such places being open. With COVID-19, we have now an added complexity, and that's how to municipalities do that while maintaining support for physical distancing. So we're right now communicating with our municipalities about that, because we have to continue to meet this need even while we have COVID-19 happening. This is part of learning to live with COVID-19, that we find ways to have cooling centers that are run so that they're still safe from a COVID-19 perspective. Okay, at this point I'd be happy to take questions.
Okay, thank you, Dr. Gardner. Let's start with Elizabeth from Rogers. Do you have a question for Dr. Gardner?
Yes, good afternoon. My question is just kind of a general question. If a worker is told they have been exposed, does the entire workplace need to isolate and be tested?
So our recommendations have been that if you have somebody who's exposed to somebody with COVID-19, and we assess with them the nature of their exposure, and we decide that it is a significant exposure, that they should be isolated, self-isolated in their home for 14 days. Now they also have the option of being tested, but even if they're tested at this point and they're found to be negative, it could be a false negative because they're incubating right now, and so they still have to remain in isolation for 14 days, even in that situation. Where we certainly before weren't recommending that everybody else in that environment, if they're just a contact and they're not yet a case, that everybody in their work environment needs to be isolated or tested. We hadn't been recommending that before. I would still say we're still not recommending that they be isolated. Those other individuals have the option now to seek testing, given the provincial directive. My own feeling about that would be that they still, they have that right, but they would not be something that I would be urging them to do. I'd still be focusing on that one person who's a contact and yet to be determined to be a case. If it turned out that that person became identified as a case, then we'd have to go back into that work situation and identify who are the contacts of that case and whether we would recommend isolation for them, and also now, with the broader thinking about testing, whether or not we would recommend broad testing in that environment.
Okay, okay, great. James Fuller from Cogeco, do you have a question for Dr. Gardner?
I do. Thank you very much. Dr. Gardner, just want to ask you about the testing processes that have been suggested by the Premier. He was calling for a blanket, walk-in protocol now across the province. However, we're obviously not seeing that, especially here in Muskoka. It's still based on setting up an appointment beforehand. Now, I understand it's a quick process of calling in and making the appointment. However, there might be a detriment still that people are just not wanting to do that. They'd rather just walk in. So is there a point where the health unit steps in and sort of pushes these assessment centers in Muskoka to allow for walk-ins?
Well, one of the reasons for appointments is infection control. I mean, you still wouldn't want these sites to become sites where people could get inadvertently exposed. So by setting up appointments, that's one of the ways in which they can stagger people coming through, manage the flow, and avoid people having face-to-face encounters with other potential clients, and therefore maintaining a safe environment. That's always going to be important. In fact, it will always be the single most important thing about the operation of these premises. And I would continue to support them in that because of the prime importance of infection control, of them being safe. So, they're all, I think, going to have to grapple with, I'm sure, a lot of questions now about changes in their operation. Do they do less in the way of assessment? Do they do less in the way of screening, that it's more of a testing center and not so much an assessment center? These are things they're going to have to figure out. And how would they handle drop-ins? Are they able to sometimes squeeze them in, or do they simply note the time that they can come back, essentially drop in for a booking, but they have to come back? They're going to have to work those. We're all together, I guess I'm going to say, have to work those and many other things out with this change and with the broader strategy to come.
just have a quick follow-up. So I just want to hone in again on the fact that the Premier did say, and this was right out of his mouth, that you should be able to walk up to a testing center and get tested. And people I've seen in our own audience are getting a bit confused by that messaging and asking why these testing centers are not doing what the Premier says that you can be doing. So where do we fix that communication problem?
I would say that we locally know what is absolutely critical, and that we keep that in mind, in the very front of our minds throughout this pandemic. And the avoidance of transmission of disease at such centers will always be priority number one.
Thank you.
You're welcome.
Thank you, James. Ian McLennan from Barrie 360's question.
Yeah, I just want to check, Dr. Gardner, the number of tests for COVID at Simcoe, Muskoka assessment centers. You mentioned 330. Was that just on Monday itself, that jump? About the 3-4 field?
430 yesterday.
And I know the gentleman just spoke moments ago. Do you attribute that to what the Premier said, that more people are open to getting tests?
I have no doubt that that is the reason.
But they still must make an appointment, correct?
I would have to go back and look at how they all operate, but I would want them all operating in a way that is safe. And if taking appointments and booking people in a staggered way is part of that, then that would be critically important.
And is it hopeful that people that are going have been exposed to the virus possibly, as opposed to those that are just getting tested, because there's still that fear factor up there too, that now they have this open window to get tested?
To me, what's most important is that people who have symptoms be tested.
Right.
And then we must always operate in a way that that can happen and that we don't lose that capacity as we open up testing for others. So first and foremost, in my mind, is those with symptoms or those who are part of an outbreak in a facility. And then beyond that, I think it's important that those who are being tested who don't have symptoms have some kind of exposure. I think it's important that they would know that this is not a perfect test, that they could have a false negative test. They could test negative and be incubating and later become a case. That therefore, if they've had an exposure and they need to be in isolation, that they abide by that for the full 14 days, regardless of the test result coming back negative. So I think that's an important thing for people to note. If people are otherwise being tested with no contact whatsoever, then they have the ability to now, clearly given what the Premier has said, I think the likelihood of it yielding a positive result is probably going to be extremely low. And I, once again, would want them to know that this, like a negative test result, is not absolute assurance at all, that they could easily get infected tomorrow if they're not careful with physical distancing, that what really matters for them is physical distancing, hand washing, and self-monitoring, and now mask wearing when they can't do those things and they're out in public.
Okay, thank you very much.
You're welcome.
Thank you, Ian. Mike Arcelidis, are you on the line? Okay. How about Dawn Huddlestone from the Huntsville Doppler?
I do have a question, thank you. We're seeing, to a smaller scale in Muskoka, some of what's happened at Trinity Bellwood Park in Toronto, where people are choosing to ignore the advice to not gather in large groups. And I don't think it's not that they're not getting the message, it's that they're just choosing not to believe that it's necessary. So what do you think needs to be done, Dr. Gardner, to get through to those people?
Well, it's an important topic, right? Because they're going to be living with this for a long time, and we know from our modeling that the more people let down their guard with physical distancing and do things like that, the more transmission we'll have in the community. And maybe they feel that they're young and so they're going to get a milder case and they're going to be okay. And the odds are better for them of that, but it's not perfect. We've still seen some young people on ventilators and occasionally dying. But they could also transmit to others and become the conduit that allows the transmission to continue to happen and to potentially affect a loved family member who is older and more vulnerable of theirs. So I think we need to keep up the messaging and the dialogue. I think everybody's got to own the issues. So if people are aware of it, they raise the question to such people. If they are actually gathered in more than 5 people, it's actually a violation of the province's directive, and the police actually can respond and, if necessary, fine these individuals or remind them that they have to abide by it. Municipalities, I think, can look at what kind of setups can they do, changes they can make in their parks or their public locations to help with this. Is it signage that's needed? Is it actual demarcation of spaces, 2-meter circles that people can use to keep their space? Are there other things that they can be doing in the way of holding people to this as best we can? We know it'll never be perfect, that people will be people to a large degree, that there'll be some violation of this, but the more of it that happens, the more likely it is that we'll get a surge that we then have to work very hard to control or potentially gets truly out of hand.
Great, thank you.
You're welcome.
Thank you, Dawn. Erica Engel from Collingwood Today.
Hello, Dr. Gardner. I'm asking about Collingwood Nursing Home. The Health Unit website has that the outbreak there is declared over.
Yeah.
And I know previously you were investigating the possibility of false positives, so I just wondered if you could update me on that.
So I was expecting that would happen soon. I guess it's happened in the interim. So now you have that information. We had the 3 individuals who did not have symptoms who, through our universal testing of all of our long-term care facilities, all of the residents and all of the staff came back positive. And they did not have symptoms. One of them developed some symptoms, but possibly that was related to pre-existing allergic condition that they had. And then that subsided. Those individuals had subsequent follow-up testing that was negative. We never declared them to be false positives. It seemed unlikely to us that you would have 3 false positives. So we treated them as true positives, even though they later tested negative. It was certainly possible that they had a very mild illness that was short-lived with viral shedding, and so the negative tests later were simply showing an end to their transient viremia, transient infection. The required duration of time, 14 days for the outbreak, passed without further incident or further cases, and so we've now declared it over.
Do you have a follow-up question, Erica?
Yeah, I have another question. I know you've spoken before about the idea of stores requiring masks, and there are some in the district now giving out masks when you walk in, like Bracket Greenhouses, Stores in Aurelia. Just wondered what you thought of that practice.
Well, I've indicated before my feeling that if businesses wish to do that kind of thing, it's their right. I understand that the Premier, from what I read in the media, supports that right. I do know that all things can be contentious. I do know that there are civil liberties groups that are opposed to that on the basis of individual freedoms. We now are recommending that people use homemade masks, non-healthcare masks, when going into locations in which they cannot be assured that they can physically distance. So shopping locations could certainly fall into that category. So you could argue that stores that are doing that are, I think, aligning themselves with that recommendation, and by providing masks are enabling people to take that precaution. And so far it remains their right to require it, if they so choose. I would put forward that they need to do all the other physical distancing measures as well. So they need to limit the number of people that go into the stores to match their space. They need to have one-way aisles, I think is a good idea because it avoids people having to cross each other. To have markings of 2-meter distances for lines, all of those things are important as well for them. To have the plexiglass barrier with the cashier on the way out. Staff potentially wearing masks, probably it is a good idea that they wear masks in those environments. So it needs to be a package. I mean, if they're going to be doing that, it needs to be part of the bigger package.
Okay, thank you. Chris Simon from the Very Advanced, do you have a question?
Yes, thank you very much. Wondering, Dr. Gardner, whether you have any idea the frequency of testing of hospital staff throughout the region?
I don't know. I know that RVH has tested over 1,000 individuals. I don't know to what degree that's staff versus patients in the emergency department or otherwise. So I don't have data on that. If we end up acquiring it, I'd be happy to provide it.
So would you recommend that hospital staff or maybe medical professionals in general be tested to some level of frequency, considering where they are?
We may very well see that kind of thing come out with the province's testing strategy. I'm aware that hospitals, a number of them are now starting to test patients coming in for procedures or surgeries. Certainly I'd be recommending that they be isolating and testing staff and patients who are symptomatic. I think it's important that they not rely on testing for asymptomatic people because, as I said, the yield, I think, is going to be low. The great majority are going to be negative, and there could very well be those that then become positive because they're incubating or because they then get infected after the test. And so it would be important that people don't let that be a false reassurance, that they continue to practice the universal masking or mask use that's now in place for healthcare settings, that they continue with their full personal protective equipment use when working directly with known or suspected COVID cases, patients, that they exercise the frequent hand washing, that they do their self-monitoring for symptoms and exclude themselves if they develop symptoms and seek testing. All of that has to continue. You can't let any of that kind of drop with the potential addition of routine universal testing or focused testing of some kind for asymptomatic staff.
And follow up if I can. We have a reader sent us a photo from, I guess they were out on the water yesterday and took a picture of a fairly large gathering on Dock Road in Barrie. Clearly they were not observing physical distancing, the folks on that dock. Are you worried that maybe people are, maybe moving some of their gatherings to either private property or maybe less visible sites within the region?
Yes. I remain concerned about the potential for transmission through public gatherings, whether it's in a public location or private. And with the good weather that we have now, I think the potential for that goes up, at least outdoors. I think that there's a potential for people to be fatiguing from all of this isolation because it's very hard on us all and we would like it all to end. And so I understand that, but I also understand that the more of that happens, the more transmission we're going to see. And that I would very much hate in a week or two to see data from here start to show an elevation. That the good weather had resulted in too much of this happening, and thus we're starting to see more cases, more hospital admissions, potentially more deaths related to it. So I have concerns, and I think it's going to be quite the battle for us, because it's going to be a marathon. It's going to require us to be doing this for a year and a half, like a long time, of maintaining these controls. I'm hopeful that maybe we can get an outlet down the road of extending our social bubble so that we have more of an outlet that way that hopefully is safe. But by people just kind of just doing it without control, we take the risk of losing control and having a surge in cases. I'm aware that Barrie has had to enforce their own bylaw about this. They have a bylaw that is similar to Toronto's about gatherings as well. It's more stringent than the provinces, and I'm aware that when the weather gets better, they have more enforcement.
Thank you.
Okay, thank you, Chris. Is there anyone on the line with a question that we may have missed?
Yeah, Doug Cross here.
Oh, hi, Doug. Go ahead.
So, Dr. Gardner, you mentioned the number 430 is a spike in the number of tests. Is there any breakout available for Muskoka in terms of how many tests were done in Muskoka? Or do we need to get that through the healthcare network? Or?
Yeah, I can give you some information here.
Okay, thank you.
So, yesterday's testing results, Huntsville 29, which is more than a doubling, or about a doubling of what they typically had. In the past, they've had anywhere between 11 and 15. And Bracebridge 35, whereas in the past, the week before that, it was between 12 and 17. More 12 than 17.
All right, very good. Now, getting to the side of the police intervening for social distancing contravention, there's been one charge that we're aware of in the Muskoka area since this all began. Are you in regular contact with the police about that? Are you taking calls from the public and about potential problems, passing them on to the police, or are you just asking people to go directly to the police?
We're happy to take calls from the public about many things related to COVID and other matters related to health and public health. The levels of our calls about COVID-19 have generally been in the range of over 100 a day, 130 a day. That's 10 times the volume that we normally get for communicable or infectious diseases, and it's remained that high throughout the entirety of the pandemic since March. At times it shot up to be as much as 100 times the number of calls we typically get, depending on what's happening. Like with our first case or our first death, we had a great surge of calls. We do liaise with the police when needed. If an incident comes up, a location of concern comes up, we do liaise with the police about it and indicate, with them how they approach that, how they follow up with that. We ourselves are taking on enforcement where it would fit with our mandates, so we're empowered as well as bylaw officers and the police to enforce these provincial directives, but we focused our direct enforcement in environments that we typically inspect, such as food premises.
Okay, thank you for your time today.
You're welcome.
Okay, thank you. Is there anyone else on the line that we may have missed?
Yes, Dana from Global.
Oh, hi, Dana, go ahead.
Thank you. So Dr. Gardner, I'm not sure if you would have seen this yet because it broke just an hour before the press conference, but our reporters spoke today that the military personnel that had went into Ontario's nursing homes had said that they had concerns regarding, and I'm quoting from the article here, a blatant disregard for infection control measures, mistreatment of residents, and a level of care described as horrible, according to documents. Premier Ford is
or the Ontario government is going to release the full report now, actually, at 1:30 today. Can you respond to that if you have seen it or aware of the information that recently came to light?
I'm afraid I haven't had the chance to review that, so I wouldn't be able to respond specifically about it. It really, without the context, it would be hard for me to give a good response.
Fair enough. Okay. Are you concerned about the, I guess, level of care within the long-term care homes in Simcoe County? I know the military weren't dispatched to any of the long-term care homes here, but just yourself, are there any concerns that you have?
Well, we did an assessment of our long-term care facilities as part of an initiative that we organized with hospitals, with paramedicine, other partners such as assessment centers. That was all part of improving their infection control when needed, making available human resources when needed, and doing the testing for the staff and the residents in those facilities. It was also part of response to outbreaks. We've had a total of 10 outbreaks in our congregate settings, one of which was a group home. The others were long-term care facilities or retirement homes. We certainly, through our assessment, became aware of ones that needed attention to improve their infection control, that they had vulnerabilities related to the design of the plant, the facility, or their infection control practices. And during the outbreak, their ability to get staff in some instances was challenged. They had to arrange for some support from a local hospital in order to assist with that. So we've seen issues for sure. From what I read more broadly in the media, there have indeed been issues elsewhere in the province. And certainly the pandemic has been very hard hitting in long-term care. More than half of the death that's occurred from the pandemic in Ontario has been in long-term care. So there are issues indeed that need to be addressed. And I do think it is appropriate for the province to proceed with an inquiry or review of some kind about long-term care, which I understand is to take place in the fall.
For sure. Thank you.
You're welcome.
Okay, thank you, Dina. Is there anyone left on the line that we may have missed? Okay. Thank you very much, everyone. We will see you on Friday.
Goodbye.
Bye.